Okay, looks like we have some attendees coming in, so we'll just give it a second and let people join. Welcome everybody to our Modern Health webinar. We'll get started in a minute.
Morning, folks just joining. We're going to give folks a few more minutes to join before we jump into our presentation today. Curious if anyone's willing to say where out in the world they might be in the chat. Curious where we have people. Amanda in Detroit. We have Laura out in Ohio. Welcome, everybody. Southern California. Honolulu, Hawaii. I think you've now taken the cake for everyone's most jealous. Personally, here in the Bay Area, it's a beautiful sunny day. I hope it's the same around the world.
Vancouver, that's near me. I'm up in Western Washington.
Got our first Bay Area representative. That's exciting. Not alone.
Okay, Maximo, we're a couple minutes in, so I think we can go ahead and get started if you're ready to go.
Let's do it.
Okay, well, welcome everybody. Thank you for joining us today for this webinar presented by Modern Health. I will be kind of guiding you through the start of it, and then we'll introduce you to our main speaker. So in reverse order, I am Cynthia Castro-Sweet. I'm the Senior Director of Clinical Research at Modern Health. Our headliner today is Maximo Prescott on our research team. He's our Clinical Research Manager. And so what you're going to hear today is I'll give a brief overview about access to mental health and where we stand, current state of the science and state of the field, and then talk a bit about our approach to solving the mental health access needs of our populations. And then I'll turn it over to Maximo, who's going to go into a deeper dive about people's preferences for mental health care and the different modalities of care that we can deliver and why that matters, why it's important to your populations, and how we can understand how these preferences influence people's use of care. This is in a webinar format, so you will see you have access to a Q&A feature. So if you have questions come up while you're listening to the presentation, feel free to drop your questions in the Q&A. And either while we're chatting, one of us may pop in to answer some of those questions, or if it's a more conversational question, we may reserve it to the end. At the end of the session, after Maximo finishes his portion, we'll do a little bit of facilitated Q&A. So we'll kind of cultivate some questions out of that Q&A box for that as well. And also, feel free to jump in at the end with questions when we open it up for that forum. And without further ado, I think we'll go ahead and get started. So it's probably no surprise to those of you in the audience, and probably one of the reasons why you're here to listen to this webinar today. There's been just ever increasing demand for mental health services. Mental health issues are becoming more predominant in the conversation amongst employees and employers. We're all aware that it's become a bigger issue, especially with the year we've all gone through in 2020, and COVID really, I think, if anything, elevated the conversation about mental health needs, and that there is need across the spectrum of mental well-being. What we've learned from previous pandemics is not only do you see these spikes in need for mental health care as a result of the restrictions, the fear, the anxiety around these conditions, there's also a bit of a lingering impact. So we can expect years of issues in mental health to be in the conversation as a result of the pandemic. So it's not a very quick solution. This is something that's going to have long-term lingering impact on our population, and something we can expect to have to solve for the coming years. the traditional model of dealing with mental health challenges has been, for the most part, one-on-one therapy with a licensed professional, typically in a face-to-face format. That's kind of what we all think about when we think about care for mental health. That's what the regulations are built around. A lot of those regulations were waived during COVID so that we could provide care through other delivery mechanisms and to use technology to deliver care. But there's a big question, what happens next? What do we go back to the old model and the old regulatory style of delivering therapy? Probably not. There's going to continue to be a shortage of therapists to fit the needs of the population. There's simply not enough therapists for the number of people who need to see therapists and kind of fit that, 50-minute session sort of rigid schedule that therapy is built for. And there's also geographic shortages. So the therapists that are available do not live in the areas where people need the care. So we're always going to be, facing this mismatch of providers to the people who need to get access. So what we really need to solve for is a way of providing more comprehensive care to more people in the ways that people want and can use the care. And so what Modern Health is really doing is we're trying to reinvent what mental health care is to provide a more comprehensive solution and be more flexible and adaptive and broader with what we can offer so that we reach all segments of the population and not just think about those people who may just prefer therapy. So, mental health is complex. I think we all realize this. There's a variety of topics and issues and challenges and stressful life events that we all encounter. And we need to be able to address all of these needs, and any one individual can experience multiple needs at any given point in time. But the type of care they may need to address those challenges may change. So what we want to be able to do is offer people a full range of options to get connected to care that is served at the right level for what they need and how they want to utilize it. So it's not all about clinical therapy. While that is effective, it's not necessarily the best mode of treatment for all kinds of issues and all kinds of conditions and challenges that people want to work on. There's other modalities of care that are as equally effective and can be better delivered, more rapidly delivered, cover more people, increase access and utilization. So things like coaching and digital content and group-based care, these are all equally valid delivery mechanisms. And what we really need to do is find the right combination for people so that we can deliver the right care to the right people in the way that they can best utilize it. And this approach really allows us to address the full spectrum of needs. And so we could think about people on this spectrum. There are people who may need more clinical level care because they're really struggling and are having impaired function and severe symptoms. But there's a lot of people who can function, but are just not at their best. Or maybe trying to preserve their mental health, right? And want to be able to optimize their performance and their functioning. So we really want to be able to reach everybody with the most broad solution. So how we go about this at Modern Health is we start by understanding our users, understanding their preferences, what they want to work on and how they want to work on it. And their current clinical state. This helps us identify and kind of understand where on the spectrum they fall. And with all that information, we can serve up the best, most dynamic pathway to care that makes the most sense for them, that is backed by evidence-based proven means to help people improve their mental health. So this is all great in theory, but we need to prove this, right? We need to prove that this works. So that is our charge on the research team at Modern Health, is to back up this approach with evidence that this works. And so we focus our approach on these three content areas. Does it help the individual? Does it make for a healthier organization? And does it help improve our healthcare spending around mental health? Those are all equally valid, important, necessary components of the equation of the benefit of this service. And how we're approaching this at Modern Health is we're looking very closely at our population that we're serving to see how they're improving, how that's impacting them and the greater ecosystem that they live in. We're also structuring specific studies and prospective studies and surveys so we can tap into elements and concepts that are valid and important, but not necessarily, we don't want to burden our members with lots of evaluation and assessment. So we'll do specially curated studies to tackle particular questions that we have. And we're really committed to objective, rigorous evidence. So we submit all of our work through peer-reviewed processes to get it published or presented so that there can be an objective lens to the work that we're doing and give us some scrutiny to show that we are using rigorous methods and improving our value. And just to give you a little teaser of some of the studies that we have coming up, we've been evaluating our coaching mechanism. I think coaching is a very common thing that we all talk about it, and it's a component of a lot of programs, but what does it mean? What does it look like? And what is the value? We've got some outcomes of our coaching on our population and how it's helping to improve people's functioning. We have also been testing the different pathways to care and what results for people if they end up in one care pathway versus another based on their needs and their current state. Do we see improvements across this spectrum of comprehensive care? And then what you're going to hear right now is more of our work that we're doing on understanding people's preferences and how those personal preferences and personal determinants really influence how people will utilize the care that we offer up to them. So again, it's about finding that ideal match of what someone needs with what they want to produce a better experience for them and better outcomes for you. So with that, I'm going to hand it over now to Maximo, who will take a little bit of a deeper dive into our preference work.
Thank you so much, Cynthia, for the introduction, and good morning, afternoon, even good night. It sounds like we have some folks that are joining us from outside of the United States, which is always exciting. Super excited to get to be here today and share our latest research that we've done on patient preferences for mental health care. So for the folks who joined a little bit later, Cynthia just gave us a really phenomenal summary of access to care and how it continues to be an issue for mental health. And so one of the most promising opportunities that we have to address this access to care issue is to what's called following a stepped care model. And that's what we practice here at Modern Health, and essentially really boils down to trying to give individuals the resources or the tools that are going to be the least resource intensive, really, so we can kind of maintain those for the higher needs, individuals with higher needs, but still be able to see improvements and that it's still going to meet their needs and be effective. And so you can also think about this as being dynamic and not static. So someone might start off with one recommendation, and if we aren't seeing response there or that, or engagement, that they might be stepped up in care, or conversely, right, perhaps they've already been treated in one mode of care and they might be stepped down. To do this, many stepped care systems have tried to optimize delivery, most by assessing clinical severity and clinical needs. But at Modern Health, we really try to take this a step further by really incorporating also the individual's area of focus. So what are the specific topics that they really want to work on, as well as their preferences for how they prefer to receive care. Very few step care models of to date have really tried to incorporate patient preferences, but we really believe that's important here, not only because I think mental health is personal, and so we really need to recognize the individual at the center of that, but we also believe stepped care not only is going to help us address access to care issues, but be able to deliver more patient-centric care that really empowers the individual to be a part of the decision-making in their care plan. Research has also backed this up. So research has found that care preferences also can improve engagement in clinical outcomes. And that's really important because you can have the most effective model of care in the world, but if folks are not willing to engage with it meaningfully, then it's not going to help them produce outcomes and improve their mental health, which is really our goal at the end of the day. And conversely, right, you could have something that is super engaging, but if it's not actually producing clinical outcomes and value to the individual, similar story there. So with this context, let's go ahead and dive into today's research, which we believe is really going to help the field better understand what people's preferences are when it comes to receiving mental health care. So given our interest really in delivering patient-centric care at Modern Health, we wanted to first explore our data to examine what are the rates of these care preferences, or what proportion of individuals are endorsing these preferences, as well as understand the predictors or the trends that we might see in expressing those preferences. And if you've ever spent a lot of time with young kids, they'll just love to ask you a million questions about why is the sky blue and how does this work, or why does that like that, I think those kids that just never grow out of that phase are the ones who end up becoming researchers and scientists. So if you have one of those on your in your family or around you, I hope you encourage them to never stop asking questions. And so the less academic way of kind of asking this question is just asking a whole set of questions like, what % of folks are unsure about their preference? Are males or females more likely to prefer self-guided care? Is age associated with preferring groups? Do individuals with those higher clinical needs like anxiety and depression actually prefer one-on-one care? And so I know methods are not the most exciting part usually about hearing about research, and I promise I'm not gonna spend a ton of time on it, but the skeptical scientist in me does have to take this opportunity to encourage you that anytime you're presented with research or data, I hope you'll at least ask, where did this data come from? Who was it collected from? When was it collected? As well as how has that data been analyzed or presented to you? And so to keep myself accountable here and answer my own questions and how we went about answering our research question in terms of methodology, we analyzed data from 3,661 employees that had registered for our platform and completed onboarding. So to be included in the analysis, they had to be adults over the age of 18 and had completed onboarding between February and April of this year, when we really started to ask every single individual onboarding onto our platform what their preferences were in order to incorporate those into their care plans. And you can see a screenshot here on the iPhone of the question we use to ask this. So we ask individuals, when it comes to your mental health, how do you prefer to work? Do you prefer to work on your own, self-guided at your own pace? Do you prefer to listen and learn and work in groups and live sessions led by care professionals? Do you prefer that traditional model of working one-on-one with a care provider? And here at Mental Health, that might mean coaching or therapy, as well as being unsure about what your preference might be. And in terms of how we went about analyzing the data, we used a few different statistical tests and models that really help us tease out what could just be a finding that's just kind of due to chance and what we really have the most confidence in actually being a true difference. So with that, let's go ahead and dive into the most exciting part, at least personally, which is really the results and what we found. So to answer our first question about what general rates or the % of folks who hold these different preferences for care, we found that the most common preference was one-on-one care with a provider, but this was less than half, so about 44% of registrants. And so that's really striking to me, right? Since in the traditional systems, right, really the only option that can typically be provided is one-on care with a provider. And think about how many folks are we missing from getting their engagement in their own mental health by not offering folks more options and alternatives. And I think if you're considering a mental health solution out there in the market, really thinking about that and how important it'll be to really get the most value out of your product and get the most folks to be engaged with it. If you only go as a therapy-only solution, you're only capturing about 44% of folks potentially. The second most common preference was for self-guided care at almost a quarter, and then a relatively smaller portion, a little less than 10%, preferred group care. And then I find this really interesting that almost a quarter of folks were unsure about how they prefer to receive care. And this is really interesting and begs the question, I think, about how, uniquely in a step care model that has all these different modes of care to offer somebody, how can you help somebody self-determine what their preferences are by giving them opportunities to experiment and explore and figure out what really works best, in their own personal life and fits their own personal mental health journey. You can also imagine there's a limitation here. So I do want to call out that we currently only allow individuals to select one preference during onboarding. And you can imagine that your preferences might depend on what you're experiencing in that present moment. It might change, right? The same way that if I take an Advil for a headache, and that might be what I prefer to do first. If I don't see improvement after a day, well, then I might want to go to my, one-on-one care with a doctor for their consultation. So these might change and they might be dynamic. And it's also not to say that just because someone's preference was for one of these, that they might not be unwilling. They might still be willing to try other things and explore. So really, how do you bake that in for everybody? And so this really leads into our next item, which is really to look at our second part of the research question, to look at what were the demographic and clinical characteristics that might be predictive of holding these different preferences for care. So we compared all of the alternative preferences compared against one-on-one care with professionals. So given it's the predominant model and the most common preference held by folks. And so all our alternatives are self-guided, whether that be digital programs, meditation, CBT modules in a group setting, or again, being unsure of what your preference is. And so we did this across quite a few different demographics and clinical characteristics. And so starting here with age, each of these bars essentially represents to you what were the distribution of care preferences within an age category. And so in terms of age, you can see that those first 3 bars are all pretty similar and no statistical significant differences between them. So 18 to 40-year-olds kind of held similar preferences across the spectrum. And where it gets really interesting is in that 45 and older age category. So while the preference for one-on-one care was the most common amongst those younger age groups, we actually see that flips in the 45 and older group, that the self-guided care was actually the most common preference, such that those who were over 45 and older were more likely to express preferences for self-guided options, group, or being unsure of what their preference was compared to one-on-one care in those younger individuals. And that's really interesting, I think, from my perspective, because in the mental health literature and research and what we might already know is that older adults have been reported to be less likely to seek care and initiate treatments. And so thinking about how this might be a way that we might be able to bring more people into the fold and really get more people access to care by offering alternatives, and specifically, in group formats or self-guided to help individuals make their own mental health journey. In terms of our next demographic, which was sex. In terms of sex, we found a small but significant difference. Oops, there we go. In terms of sex, we saw a very small but significant difference in the likelihood of preferring self-guided for males. So males are about 1.5 times as likely to prefer self-guided care options versus one-on-one care than were females. And then the most common preference across the groups and the sexes was still one-on-one care. And we didn't find any significant differences between males and females when it came to groups or being unsure of what their preference was. And so similar to age, this is interesting because males are another group who are known to be less likely to seek treatment or support for their mental health. So again, thinking about how we might be able to improve on these traditional systems by offering more alternatives that might have to get people who have historically not engaged with mental health support to be able to really to improve access to care and to offer more patient-centric care. Moving past demographics and into clinical severity and what we found that was associated with care preferences. So we used the PHQ-2 or the Patient Health Questionnaire 2 and the GAD-2, which are both clinical assessments for assessing and screening for depression and anxiety, which are 2 of the most common mental health conditions. What we found was that individuals with a positive depression screening were significantly less likely to endorse preferences for our alternatives, being self-guided group or being unsure, compared to one-on-one care. We see the same trend repeated in the individuals who had screened positive for anxiety at onboarding compared to those who had screened negative. So those who had screened positive were less likely to prefer self-guided group or being unsure compared to one-on-one care. And this is encouraging because it sort of indicates to us that individuals' preferences for care are being informed by their symptom severity, whether they know it or not. And we generally consider this to be really positive since those conditions are indicative of a greater clinical need, being candidates probably for potentially more intensive care. But I also want to make sure that I think there's a little bit of a misnomer that like self-guided options and group options can only be for folks who don't have clinical conditions. Research has found that those can be really effective treatments. And so you can still see there that here, even though there's a preference, more majority wise, but like there's still other folks who prefer to work on those other options as well to keep in mind. And then the last question that I want to cover today that we ask individuals, is what they're coming to our platform for support with. So those topics that individuals are able to select cover multiple dimensions of well-being and include things like emotions and finances and physical well-being, professional life, relationships. I'm sure we can all acknowledge that all of those things really affect our well-being at the end of the day. And what we found was that similar to the clinical characteristics, individuals who are presenting with a focus on emotions, as well as those relationships, were significantly more likely to prefer one-on-one care modalities compared to the alternatives. So in terms of a preference for self-guided versus one-on-one care, individuals looking to work on their finances, physical well-being, and professional life were significantly more likely than those who are seeking support for their emotions. And you can really see, I think, strikingly see that for the physical well-being one right in the middle. So you see that only about less than 20% wanted to work one-on-one with a professional, while the near majority of them preferred to work self-guided at almost 44%, right? And that's pretty much the polar opposite when you look at folks in the emotional or the relationship needs. Nearly 50% of them wanted to work with a one-on-one professional, as well as only 20% of them being interested in self-guided work. In terms of group versus one-on-one care, individuals looking for support with their physical well-being and professional life were slightly more likely compared to those than the ones who are working on their emotions. As well as lastly, focusing on your physical well-being was slightly more likely to be unsure about their preferences for care compared to those focusing on their emotions. And so that summarizes all of our results. And in the next slide, a really exciting role of research here at Modern Health is we really get to foster a culture of how do we continue to improve our product and getting to work cross-functionally with how do we translate this research into practice. And so I'm going to give some summary here, both of what, the high level results that we found and insights, as well as what the implications are and how we're acting on these at Modern Health. And I also wanted to provide you all as employers or individuals in your own lives, how you might consider how this research might translate. So in a large sample of employees with access to the Modern Health benefit, we found that care preferences are mixed and that fewer than half, or about 44% of individuals, indicated that they preferred one-on-one care. About a quarter preferred self-guided, another quarter were unsure, and caring groups was the least common, but around 10%. And so some examples of how we at Modern Health are acting on this insight and information include continuing to invest in new modalities of care. We want to continue to be able to deliver the most patient-centered care that we're able to, and that will mean include more care options as more are found to be effective and valid treatments. As well as exploring strategies and how do you help engage that quarter of individuals, self-determine and explore their preferences and figure out what that might be. And so given that research has found that incorporating people's preferences is really important for engagement and outcomes in care. And then lastly, for employers or individuals thinking about your own mental health, I think this finding just really helps underscore the importance of offering multiple different modes of care, since preferences are likely to be mixed. And if you have access to multiple, you're going to be able to really find what fits best for your own personal mental health journey. We also found that care preferences were associated with demographics like age and sex, such that those who were 45 and older were significantly more likely to prefer self-guided care. And those 45 and older were also more likely to prefer groups and being unsure of their preference compared to one-on-one care with the provider, compared to the younger individuals. In terms of how we are actioning on this potentially at Modern Health, include, our teams are considering how might we really target engagement campaigns for these populations to really highlight our self-guided group, or that we offer multiple different modalities of care to them. And I think that's really important because, where the traditional system has kind of left out a lot of these people in the fold and we haven't been able to engage them. Well, we need to think about how do we get creative in order to, because everyone deserves a right to good mental health. In terms of also considering for when we're coming up with our content for self-guided and group care options, how can we consider these demographics, make sure we're really delivering culturally centered care that acknowledges that we all have our own culture and that, we bring that into our own mental health. And so how might we be able to best accommodate that? And then for employers, I think the take home here, or for individuals thinking about mental health solutions out in the market, is keeping the demographics of your employees in mind when evaluating mental health solutions. I still believe that, a comprehensive solution is probably going to be the best for you. But if you're unable to, for, resource constraints, the same way that there are not enough therapists in the world, is to really keep that in mind, right? So if you have a population and a workforce that is, much older, then those self-guided and those group options might be more relatively important than if you had a younger population. And then lastly, we were really encouraged to find that preferences for care are being informed by the clinical characteristics and needs that we would consider on the clinical side. And so in terms of how we might action on this, is to think about the potential for blended care options to really introduce new modalities of care to individuals that are working one-on-one with their provider. And that's really important. So another question I kind of have after leaving this is how much of this finding that, one-on-one care is the predominant preference for folks with more higher clinical needs is just being driven by the fact that our mental health system has been guiding them to that, potentially their entire life. So that doesn't, again, mean that they're not willing to try new things. And if you also think about the scalability and the long-term vision, right? You can't work with a therapist for life potentially, but we can work with you to help, on those like high acute needs and then set you up for success in the future so that you don't relapse and that you're able to sustain that mental healthy status. And then lastly, for employers, I hope if I've convinced you of nothing else, that you should have confidence in asking, and you should be asking your employees about their preferences if you're looking at mental health solutions, because they are informed and they can participate in that conversation with you. And then as researchers, like those kids that just keep asking you, why is the sky blue? We hardly ever believe that we've definitively answered a question, and we almost just always walk away with more questions and hypotheses that we want to test. And so some future directions for this work and in research, I hope, into preferences for mental health care include really investigating other characteristics that we didn't get to here in this study, and how those are impacting people's care preferences. So things like mental health literacy, or how much knowledge does an individual have about mental health, or attitudes that are going to help them take care of themselves. And you can think about that like stigma, right? How might stigma be affecting the preferences that people hold for mental health care? Prior history with mental health care. Again, as I mentioned, we found that individuals who have, this higher clinical needs are more likely to prefer one-on-one care. I'm really curious now to really more dig into like how much of that might be explained by the prior history with mental health care. Are they open to trying new things? And how might you best incorporate that to really help those individuals learn tools and skills that they can take on throughout the rest of their life to continue to have good mental health? And then, really another key one is really to just incorporate more demographics. So things like race, ethnicity, geography, sexual orientation, gender identity, and really start to build and acknowledge that mental health is personal health, and that, people are really at the center of that, and the culture that we each have is reflected there. And then I always love to crowdsource great research ideas, and you all have fabulous minds that I would be so curious to hear what other things you think might be impacting mental health, whether that be other demographics. So please leave those in the chat, and please also bring those to our QA session at the end of this. And then lastly, we really would hope to build on this work further by better understanding how does incorporating care preferences into our recommendations for folks as care plans really affect that engagement and clinical outcomes. Because at the end of the day, we really want to see these kind of things help us improve the care that we're offering so that folks are living healthier, happier, healthier lives. And so that said, I would love to thank you all so much for joining us and your attention this morning. This research is currently undergoing peer review for publication, so it's not quite fully ready yet, but a preprint can be found on JMER preprints. And we also have a 3-page summary available on our website. I would also love to thank, we had 2 academic rockstar researchers that collaborated on this with us, Dr. Alyssa Kozlov at Rutgers University, as well as a real rockstar, Megan McDarby, who is a PhD student at the University of Washington in St. Louis. We'll also have a 3-page summary of our research paper available on our website at the link here. And if you have questions that you don't have time to stick with us, I hope you do, so we get to chat. Please contact our research team either at research@joinmodernhealth.com, or you can talk to us more broadly about modern health at info@joinmodernhealth.com. So with that, Cynthia, let's open up the Q&A, and I'd love to hear people's thoughts. You are on mute. That's
Hang on one
usually
second.
me.
I'm going to get back in there to get to that last slide. So just a couple things for people, that you will get access to these slides at the end, as well as the recording. So you'll be able to actually click on these links, because I don't think you'll be able to do that just through watching the Zoom. But this will be coming shortly, so you can get all that information. And we did have a few questions in the Q&A, so I'll serve those up. If there are other questions from the audience, feel free to add those to the Q&A. That would be really helpful. So if you're ready, Maximo, you can serve up some of the questions. So the first one was asking about if preferences differ across our global members. And that's one thing that people may not be aware of Modern Health, is we actually serve beyond the US and in a variety of different continents and countries.
Yeah, this is a fabulous question. I think this person is probably a researcher, or should be, or might want to consider it. So do preferences vary across, global members? It's a great question. I don't think anybody has answered this question yet, which is so exciting for research. Probably very much so, right? So demographics change, culture change. So much about mental health is cultural. And so it's very true. We definitely hope to continue to explore this, especially as our internationalization, we're getting more and more members by the day in different places, and we're going to be able to start really aggregating that data to better understand it.
Terrific. Thanks. Okay, and then our second question, really great, interesting question. To what extent do you measure the success of one modality on an ongoing basis with an individual and determine if you will continue or switch? I'm assuming the modality based on the measurement.
Another fabulous question. So it's a hard one to answer. I think we're still figuring this out. I think everyone's still figuring this out, right? There's the risk that you might change somebody's treatment. Mental health treatments can take a while they're not overnight like a pill. And so it takes some time. And so the question becomes, are you just switching somebody up too early or too late? And I think we're hoping that we're going to be able to continue to kind of help guide the research in that area in the future. But I think it's really important that as part of Modern Health members are always able to reach out and ask for more care. So we really want to make sure that individuals are helping guide that. So it's not necessarily just us as researchers or us as clinicians informing this decision about whether you should be stepped up or down. We really want to put people at the center of that decision as well. So we're continuing to engage them in their own mental health and empower them too.
Terrific. Okay, there's a couple more questions coming through the chat. So I'll go ahead and serve you up a couple from there. So first of all, what modality options are getting the most engagement from employees? And is there any correlation between the modalities and the clinical outcomes?
That's a great question. So as I mentioned, we only recently started really asking this question. And so we're currently waiting for a little bit more data and a little bit longer before we really start to ask the questions about what are the engagement like in each of these modalities and how is that aligned with their preferences. Inevitably, right, there are going to be some individuals, those preferences change over time. So we have to capture those changes as well, right? So perhaps you have an acute event, you gave a preference to me 3 months ago that said you wanted to work on your own, but perhaps something's changed in your life and now you really want to look for one-on-one care with the provider. So I think it's going to be a really interesting scientific challenge to try to tease all of this out, to try to figure out what are the rules of the road and how we might be able to best guide folks at the right time to get that right level of care.
And I think one thing to keep in mind is that the modalities are not mutually exclusive, right? We don't limit people to you only get coaching, right? They can actually get more than one modality at one time or across their experience with Modern Health. So it's a terrific question. It's a complicated pathway to answer that because there's so many different ways that people can get care, and the amount of time they spend in one modality versus another or in the combination, I think is what really makes it interesting. But I think what's probably more important is, regardless of the care modalities that people use, are they improving, right? Because that's really where the personalization comes in. And the preferences matter. So we don't ever want to be in a position where we say, well, coaching is the most effective, everyone should get coaching. That's not necessarily true. It depends on how you study it, who ended up getting coaching, right? So kind of the inputs you put in can determine what the outcomes you get. So we want to make sure that we're giving people that comprehensive experience, and that regardless of the pieces of the care that they get access to, that they're all improving and moving in the same direction.
Absolutely.
Another question. We're starting to see demand within my employee group for AI-driven platforms, mostly the ones for which there are ads before watching a YouTube video, or the ads that interrupt your favorite podcast. Is there any good data on if these relaxation and mindfulness apps are effective at all?
It's a great question, Jeff. And I think I'm really encouraged that Modern Health is taking the approach of really investing in our research team to ask these hard questions of our product. Is it working in the ways that we believe it is? Unfortunately, if you look through the solutions, not a ton of teams actually have very active research groups. They're either very small. And so that's really where the importance of, I think, research and science comes in, to making sure that these, apps, anybody can put an app on, the App Store. It's not a very high bar. Is to make sure that those are being vetted, that those actually produce value again, right? Because we want to make sure that people are engaging in their care, want to make sure that they're getting good value and clinical outcomes out of it. And so it's kind of a whole spectrum. You have some that have started really to produce evidence and outcomes, and you have a lot that are just completely untested. I think last I looked, there's something like 20,000 mental health apps in the App Store, and the vast majority of them have not produced a lot of evidence yet.
Mm-hmm. And it's also important to think about, is this a point solution? Is it serving a very particular need, which mindfulness and relaxation are useful for certain conditions? They're not useful for every condition. Do they feel good? Yes. Do they necessarily produce clinical benefit across the spectrum of mental health issues? Not really. So they're good for what they are, but you have to think about, is it really the most comprehensive solution that's going to fit all the needs of your population? That's, I think, is a more complex system to contemplate. There's another question about the cost for the platform. I'm assuming we're talking about cost to Modern Health. So one of the benefits of Maximo and I being on the research team is that we're not on the sales team, and we are not part of those conversations. But I would just encourage you to direct that question to the info@joinmodernhealth.com, and you can get connected to a representative who can walk you through our our payment processes and the different pricing mechanisms that we have working with employer groups. Let's do a quick time check. We have a couple of minutes for a few more questions that have come up in the Q&A. Is there any research or guidance on how to engage employees or clients in seeking support in the first place? That's a great question. I feel like there's so many people who we don't get to reach due to the stigma around seeking any type of support. Excellent question.
Yeah, I think one of the best things you can do is just normalizing this conversation. I think so much of mental health and that stigma is just really associated with thinking of folks who have very high clinical needs and not thinking really about mental health is like physical health. We can all work on it at all times. We can do things that are preventative so we can maintain mental health and not, just wait until we hit the point of needing more higher level support because we have a condition. So I think just really having these conversations, and especially as an employer, right, you hold this really special place. I think, so much of our lives is spent at work. And so we really bring our full selves to work. And so I'd have to say that at least working here at Modern Health, just how much of our conversations are about mental health and people struggling and people being vulnerable. So if someone is sharing, about their mental health, that they're being extremely vulnerable in that moment, and to really encourage it and support it, because we can only help folks if we know that there's struggles that they're going through.
Right. And I'll add, there's good research showing that improving people's literacy or knowledge about mental health helps to activate them to seek care. So some of the stigma is related to people's just lack of familiarity with the content and not knowing how to find information. And whenever there's something we don't understand, I think that tends to breed a bit of fear, and that's where the stigma can come from. So helping to elevate the knowledge level of your population is a terrific way of trying to kind of change the conversation around mental health. So, adding some, interesting information, factoids, anything to help socialize people to the fact that mental health is something that we all have, and we all have our challenges and struggles, and mental health looks like different things, and just doing these small bites to try and increase the knowledge base and help people be more familiar with having conversations around mental health can help people acclimate and kind of socialize them to wanting to take the next step. We got another specific question, Maximo, about this particular research. Was this research done within Modern Health's app? If so, what was the process of measuring clinical severity within the app?
Yeah, thank you so much for the question. Yes, this research was done with our real world data. This was not collected necessarily just for a research study. It's just normal real world data that's being generated in our app, de-identified. So of course, there's no way to ever link this to an individual. And that process of measuring clinical severity, there's quite a few different kind of things we do. And some of it is our special secret sauce. And I don't want to give away too much of it. But as I mentioned, we're really screening individuals at that onboarding with really short, really valid assessments that can give us really good indicators. Is this person likely to have depression? Is this person likely to have anxiety, based on great evidence base and research that's been already done by other folks?
Okay, another really good question. Are you finding people have a preference predominantly because of an assumption versus a well-rounded understanding of topics like group sessions versus one-on-one or coaching or therapy?
This is a really great question. And I think this is another question for the future that we really need to answer, which is to better understand, what is people's mental health literacy that Cynthia's already really nicely succinctly talked about, which is like, how much knowledge does someone have about, or attitudes they hold towards mental health, and how those are really impacting that, preference for certain modalities, as well as thinking about the psychoeducational things you can do to really challenge these, unfortunate assumptions that folks have that group sessions or one-on-one aren't effective, or that coaching is not, an effective modality of care.
Thanks, Maximo. Okay, so that's all the questions we've gotten through the chat and through the Q&A. And we are about at time. We got about another minute left. So I'm going to take advantage of that last minute. I've put in a link in the chat window to a very brief survey. We would love to get your impressions and your feedback about this webinar, if you found it helpful, if it was informative, if this is the kind of content that helps you make your decisions for your population. So please follow that link in the chat and complete our survey and help us get better at delivering better information for you all. And with that, I think we'll go ahead and say goodbye. Thank you all for attending. Really appreciate your involvement. Again, you'll get copies of the recordings and the slide decks afterwards based on your registration email that you used to sign up for the webinar. And thank you all so much for giving us your time today. Really appreciate it.
Yeah, thank you. We're scientists. I'm just going to make a plug for that survey. We love data. We'll take all the data we can get. So I hope you'll take the opportunity to fill it out for us. And thank you again so much just for your attention.
I'll just stay on to see if there's any last minute questions that come up through the chat.
Absolutely. Any questions, any great research ideas? I think after all these Q&A, I've gotten a bunch that we can take and
I know, that's
incorporate
the best
into our
part
work.
is like, different perspectives help you see our blind spots.
Absolutely. The more minds, the better, I think.
All right, Maximo, I'm going to let you go. I'm going to go ahead and close it out for the remaining attendees and thank you. And I will see you later.